This is another video that is made to help people that are preparing, candidates preparing for the SCA exam, the RCGP exam, towards becoming a general practitioner in the UK. Now, there's something you need to be aware of in the SCA examination, which the examiners are, are seeking or looking out for, and that is called ownership. From the name, you need to own your decisions, you need to own your management, you need to demonstrate ownership, really, in your consultation. And this is something that the examiners will be looking out for, trying to see whether you are confident in the things you're saying, or whether you're just, whether you're overcautious. And I'll just explain what I mean by this ownership. You might have heard it, but it's something that you need to keep in mind as you step into the clinic to sit your SCA examination or assessment. Now, by ownership, you need to picture it this way. When you're sat there with the patient, it's a simulated consultation, either a video consultation or a telephone. While you're sat there with your simulated patient, you need to be calm, confident, not arrogant, not overconfident, but you don't have to be nervous. You don't have to be overtly nervous, fidgety. You need to see it as a clinic, as a consultation, and not an exam. You need to psych yourself up. Don't see it as an exam. See it as a consultation. The same way you don't show up at work, fidgeting when a patient walks into your clinic. You need to be calm, composed, confident, relaxed, okay? And approach the consultation as a consultation with the aim of trying to understand what your patient is presenting with, and trying to help them with the right, safe, and appropriate management. So it shouldn't be fidgety. Now, something else with ownership is when you come to the data gathering aspect. How do you demonstrate ownership in data gathering? You need to clearly, figure out what the patient has come with. If the patient has come with multiple problems, then the examiner needs to be seeing you demonstrating the ability to triage, the various complaints, and doing that with the patient, alongside the patient, managing that and selecting the most important thing that has to be addressed on that day. And obviously the maturity with which you structure your data gathering and discuss the diagnosis with the patient and the management, right? Now, in the management aspects, you demonstrate ownership by not referring prematurely, not referring when you should not be referring, not referring when you should be buying time, by initiating some conservative, either watch and wait, or prescribing some medications, or doing some behavioral, modifications or dietary modifications, and following up that patient with a safety net if needed. So not doing a knee-jerk referral, if you decide to refer, doing the appropriate referral. For instance, some patients might need a routine referral and not an urgent one. Some might need a 2-week wait referral and not urgent or not routine. So being able to decide the time frame behind any referral you're going to do, and being able to clearly verbalize or vocalize the thought process that led up to that decision. So not just say, I'm going to refer you urgently. You have to say, I'm going to refer urgently, or based on the things, based on everything you've told me so far, this and that, and the absence of this and that, I think it's reasonable for us to refer you on a pathway we call the 2-week wait or suspected cancer pathway. I don't want to scare you unnecessarily, but we need to be doing this for this or that reason. Carrying the patient along, verbalizing the thought process that has led to whatever decision you decide to follow, and own it. You don't have to, your voice shouldn't be shaky when you're discussing management. The examiner needs to see that you're having a clear thought process. You're measuring risk, okay? You're measuring, the level of risk. You're reaching a decision with that patient. Now, this doesn't mean you have to be unsafe, because when we say measured risk, we don't mean you shouldn't refer when you should, if you know what I mean. As much as we're saying don't refer when you should not refer yet, we also don't want you sitting on things that are obviously dangerous or potentially life-threatening or potentially dangerous. For instance, if a patient has clear caudal equina symptoms, you need to be referring that patient to A&E immediately. If they have someone to take them along, or you need to be getting an ambulance if they are not able to get to A&E on their own. Now, if you prescribe analgesia for that patient and tell them to come back in a week or two, obviously that is clearly you being you're seeking risk, and you're not clearly being able to identify immediate risk and act on it. So it's about balancing. It's all about risk management and risk balance. You don't have to be too risk averse, and you don't have to be unaware of risk. Okay, so that's ownership in a nutshell, really. That confident approach to your consultation, avoiding unnecessary referral, being able to think aloud or vocalize and justify the reason, the thought process behind your decisions, making clear decisions, and being able to manage uncertainty safely. The examiner has to be confident that if you become a qualified GP, if you pass that exam and become a GP, and the following day the examiner has to see you as someone they want to employ in their clinic, essentially. So think about ownership and reflect on how you can demonstrate this in your SCA, your assessment or examination. I hope this has been helpful. Drop your comments, your thoughts on how you think you'll be able to demonstrate ownership in your examination.